Xarelto is a pharmaceutical product containing the active substance Rivaroxaban. Rivaroxaban is an anticoagulant commonly referred to as a blood thinner. Xarelto is designed to prevent the formation of blood clots by inhibiting a specific clotting factor in the blood. Indications: Xarelto tablets are indicated for the following conditions: prevention of blood clots in patients undergoing hip or knee replacement surgery, treatment and prevention of deep vein thrombosis and pulmonary embolism, reduction of the risk of stroke and systemic embolism in patients with non-valvular atrial fibrillation, treatment of deep vein thrombosis and pulmonary embolism. How to use: Xarelto tablets are intended for oral administration and should be taken as prescribed by a healthcare professional. The dosage and administration instructions are as follows. The dosage of Xarelto can vary based on the specific indication being treated. It is important to follow your healthcare provider's instructions closely. Common dosage include: for prevention of blood clots after hip or knee replacement surgery, typically 10 mg once daily or for a specific duration as determined by a doctor. For treatment and prevention of DVT and PE, the recommended dose is usually 15 mg twice daily for the first 21 days, followed by 20 mg once daily thereafter. For atrial fibrillation, the standard dosage is 20 mg once daily. Xarelto tablets should be taken with a full glass of water, with or without food. It's important to take the tablets consistently around the same time each day to maintain the effectiveness of the medication. Contraindications: Xarelto tablets are contraindicated in the following cases: active pathological bleeding, severe hypersensitivity or allergic reaction to Rivaroxaban or any of the components in the tablet, patients with a history of certain bleeding disorders, pregnancy and breastfeeding unless advised by a healthcare professional. Special instructions: inform all healthcare providers, including dentists, about the use of Xarelto before undergoing any medical or dental procedures. Do not discontinue or change the dosage of Xarelto without consulting a healthcare provider, as it may increase the risk of blood clots. Xarelto may interact with certain other medications, so inform a healthcare provider of all the drugs you are taking. Side effects: common side effects of Xarelto may include bleeding, minor to severe, bruising more easily, muscle pain, nausea, dizziness. Serious side effects are rare but may include uncontrolled bleeding, allergic reactions, blood in the urine or stools, signs of serious neurological issues such as weakness or numbness,